Hello, I'm Michael Morgenstern, founder of Medwiser. I decided to create this video to introduce the Medwiser Wiki, establish its importance, and tell you some information about Medwiser. I started Medwiser back in 2005 because I was always sensitive to HIV, having had a relative who was a physician who passed away when I was a young boy in the 80s, and later on learning about how it impacts young people in the United States and around the world, I was really drawn to do something right away. HIV is a huge problem globally, accounting for 25 million deaths since 1981, and creating 15 million orphans, AIDS orphans currently, who have lost at least one parent to HIV. The impacts of this are great. You can just imagine what it's like to have to grow up without a parent and guidance. And the fact is that on a macro level, it reduces the amount of education in countries, the economics, creating poverty, and obviously the overall health care of individual countries. So there's a lot of information online. Why do we need another source of information on Medwiser and from Medwiser? So Medwiser is trying to leverage the internet and technology to change behavior and to create a social network that allows anybody to volunteer their time to support and educate others. The Medwiser Wiki is similar to Wikispaces in that anybody can go ahead and modify content. And we're in the process of recruiting volunteers who are infectious disease fellows to contribute to this wiki. Part of the reason is that a lot of the online content, based on reviews from the Journal of the American Medical Association and other peer-reviewed journals, are either incomplete, inaccurate, or difficult to understand. So we're trying to develop dynamic content that could be read by either a doctor or by an individual who doesn't have a lot of education. So somebody from Ethiopia who might speak English might come to a website like WebMD, read about HIV, and not really understand things. On the Medwiser Wiki, we're creating different types of content. So you could go there and read information and only have 6 years of education and still understand the content, whereas WebMD might require 14. E-medicine might require 18 years of education. So that's one thing that we're doing with the Medwiser Wiki. The other thing is, because HIV affects individuals from around the world, we want to have individuals from around the world contribute to the content. So we're taking infectious disease fellows in the United States who represent countries from around the world, individuals who grew up in Africa, who grew up in Ghana, grew up in South Africa, in areas around the world that have high HIV prevalence. And because of that rich experience that these individuals have, they can also develop a type of content that is more rich, that is more dynamic, that individuals can relate to from these countries, and also create articles that are specific to those countries. And we're leveraging technology by utilizing a wiki. Individuals can go on and contribute, modify articles, and following the rules of the wiki can actually create new content that is not available online currently. So that's why we're actually creating that content. It's not the only thing that Medwiser is doing, but in terms of the content, create something innovative that can be used around the world by other not-for-profit organizations to teach individuals, to educate individuals, and really to change behavior. And that's another thing about what we're trying to do differently with our content. You see, too often, content online is about informing individuals. Now, we realize that, obviously, that is part of teaching individuals, but we want to be able to change behavior, and we want to fill that gap between providing information and changing behavior. Now, what do I mean by that? I'll use a proxy, and that would be smoking. So the organizations in the United States, like the American Cancer Society and others, that in the 80s were doing a lot of different types of campaigns to educate the public about the dangers of smoking were actually reviewing their statistics and noticing that they weren't really changing the amount of individuals who were smoking. They weren't getting the type of impact that they would expect. So they went back and they saw that their messages focused on the dangers of smoking. And they interviewed their population, and they discovered that actually 7 of 8 smokers had either tried to quit or knew that smoking was dangerous. So what was the reason that they weren't quitting? What they discovered was that individuals knew about the dangers but felt it was too difficult to quit, and so they wouldn't make the effort to go ahead and change their behavior. So what changed was the American Cancer Society and these other organizations started to change the population in which they were advertising to. They advertised to doctors to provide support and counseling, and they advertised to businesses to develop new forms of pharmaceuticals and techniques to combat smoking. So that's when Nicorette gum came forward, the patch, other types of interventions that were later used. And that's when the integration of that patient-physician dynamic came about, where in every single doctor's office, a patient could expect to hear the doctor talking about smoking and letting them know about support groups and that other individuals had accomplished what was really something that was actually rather difficult. As a result of that effort and a new focus on changing behavior, new numbers emerged. New statistics emerged that showed the number of new smokers, the number of quitters were going down and up, respectively. So Medwiser is trying to use that as a proxy for what we're trying to do with HIV prevention. The content we're creating on the wiki is dynamic, it's new, it's innovative, it's exciting, and we're going to, one, provide that information to individuals who need it. Secondly, we're going to bring individuals who need that information to the website to view that content. And thirdly, we're going to establish partnerships with other organizations so that in areas in Africa, let's say, that don't have access to technology, organizations that are making technology available will also utilize our resources to educate their population. So an example of this is an organization that I met when I was down in a conference in Austin, the Clinton Global Initiative University. I met a group that was actually educating educators in Rwanda on how to use IT and information technology. So I said to them, wouldn't it be useful if you guys could also educate those educators about information pertaining to HIV, which then they could go about and teach their students? And of course they said yes. And then I went to a whole bunch of other groups that were also doing similar work, where they had access to populations with high prevalences of HIV, and with the same type of approach, they said to me, yeah, we'll go ahead and we'll use that information. So we feel very confident that by September of 2009, we can bring a lot of this content out to the public. We also know that utilizing technology, we can bring individuals who wouldn't even consider HIV testing or other types of behavior adaptations to come to our website and learn about HIV, find out where they can get tested, how they can get tested, how they can prevent the spread of HIV. So this Medwiser Wiki actually is something that is extremely important, urgent, and can have a big impact in the world. I hope you'll take part in the wiki, help us create this dynamic content, and fight this big challenge, which I believe is the greatest health challenge of the 21st century.